Ladies and gentlemen, I extend my warm greetings to you all. My name is Siti Nur Izzati Binti Hamdan, and I am privileged to share with you my research title, Factors Associated with Fruits and Vegetable Intake Among Breast Cancer Patients in National Cancer Institute. In today's presentation, I will delve into the background, objective, methodology, results, and conclusion of this study. According to the World Health Organization, breast cancer is the most common cancer among women, both in developed and developing countries. Among 1 out of 10 women affected with breast cancer globally, over the past few decades, breast cancer incidence rates have exhibited a discernible rise, rendering it a leading cause of cancer-related mortality worldwide. With almost 2 million new cases diagnosed globally, breast cancer incidence in Asian population reported to have approximately half from the total population reported by GlobalCan 2020. While there are many research studies discussing about diet and nutrition with breast cancer, in Malaysia, there exists a significant research gap regarding the connection between breast cancer and the consumption of fruits and vegetables. Although studies in other countries have explored this relationship, there is a lack of research focusing specifically on the Malaysian population. Take a moment and think why this is important. Study by Kiko et al. 2019 mentioned that sedentary lifestyle and poor dietary habits can lead to inflammatory process, creating an optimal setting for breast cancer growth and progression. So, by consuming high-calorie food that high in sugar and saturated fats, and inadequate amount of healthy food that rich in omega-3 fatty acid, fiber, and antioxidants will increase the inflammatory process. Therefore, World Health Organization recommended of at least 400 grams per day of fruits and vegetable intake for adequate consumption. Studies show that 80% of breast cancer patients fail to achieve the recommended intake of fruits and vegetables. Notably, previous study by Summer in 2020 found that less than 20% able to achieve the recommendation intake. Meanwhile, in the local context, it was reported that the consumption of fruits and vegetables increased, which primarily were made in response to nutritionist guidance as well as a desire to treat cancer. Nevertheless, there have been inconsistent findings concerning the consumption of fruits and vegetables among breast cancer patients. Therefore, this study aims to determine the factors associated with fruits and vegetable intake among breast cancer patients in National Cancer Institute, Putrajaya. Moving on to the material and method. A cross-sectional study was conducted in the Oncology Clinic, National Cancer Institute, Putrajaya, Malaysia, among breast cancer outpatients during April until May 2023. Ethical approval from Medical Research and Ethics Committee and approval permission from Clinical Research Center of National Cancer Institute was obtained prior to the data collection. The inclusion criteria including all breast cancer outpatients aged 18 years old and above, Malaysian, and able to communicate verbally. Patients with chronic disease and fluid retention were excluded in this study. Variables included in the study were socio-demographic characteristics, anthropometric measurement, biochemical data, which is albumin and hemoglobin, medical characteristics, and stress level. Most of the information of the participant obtained through researcher-administered questionnaire. Participant data on anthropometry measurement, biochemical data, will be obtained through the medical record. Meanwhile, 10-item perceived stress scale PSS-10 used to assess participant perceived stress level. And food frequency questionnaire FFQ, adapted from National Health Mobility and Survey 2014, used to assess respondent intake regarding fruits and vegetables. Fruits and vegetable intake of the participant were calculated by using this formula. The conversion factor, which determined by the frequency of intake, either it is daily, weekly, or monthly. The total of less than 400 grams will be classified as inadequate, while greater than 400 grams is considered as adequate. The research was conducted starting with selected the National Cancer Institute Putrajaya, specifically Oncology Clinic. Then breast cancer patients were filtered based on the inclusion and exclusion criteria. Next, the consent form and information sheet is provided if the patient agreed to participate in the study. Then the researcher interviewed the participant and used the researcher-administered questionnaire for the information needed, and lastly, the medical record is reviewed to obtain the biochemical data of the participant. Now, let's see the finding from this research. For the socio-demographic status of the participant, most of the respondents fell into two age groups, 25 to 54 years old and 55 to 64 years old, around 50%. In terms of ethnicity, the respondents had diverse background, which the majority being Malay, followed by Chinese and Indian. Regarding their educational level, none of the respondents had no formal education, while more than half had received secondary education. Additionally, most of the respondents were married. Besides, most of the respondents also unemployed and had household income less than 2,500. Next, for the anthropometry measurement of the participant, surprisingly, most of the respondent body mass index classified as overweight compared to other classification. Meanwhile, looking at the biochemical data, both hemoglobin and albumin status of the respondent mostly were normal. Next is the medical characteristic. The finding noted that almost half of the respondents did not receive any treatment yet due to newly diagnosed and majority were follow-up patients. Besides, more than half of the respondents have completed chemotherapy, surgery, and radiotherapy. Almost half of the respondent current stage is stage 3, and most of the respondents were diagnosed within less than 1 year and 5 years. Moving on to the stress level of the participant were mostly in category low and moderate stress. And as for the intake of fruits and vegetables, the result indicated that half of the respondents, around 50%, achieved the adequate intake of the World Health Organization recommendation, and the other half, which is 50% of the respondent intake, were inadequate, which is less than 400 grams. However, the total mean intake of fruits and vegetables among respondents was 544 grams, which has achieved the World Health Organization recommendation of at least greater than 400 grams. Interestingly, there were no association noted for all of the variables. However, as for the socio-demographic status, the marital status, household income, and employment status, the finding inconsistent with the previous study, which reported to have significant association with the consumption of fruits and vegetables. Same goes with the anthropometry measurement, but this current finding is consistent with the previous study that reported BMI of breast cancer were not significantly associated with fruits and vegetable intake. As for the biochemical data, no association noted from this study. Next, the finding from medical characteristic of the participants show that there is no association with fruits and vegetable intake, and this finding is consistent with previous study by Lay et al. 2018, in which reported that the proportion of participants that consume adequate amount according to the guideline is increased with a higher cancer stage. Following the stress level, this finding is consistent with a previous study by Wang et al. 2020, which also reported that no association between breast cancer and vegetable and fruits consumption in relation to high perceived stress level. As there is no association reported from this study, it shall be noted that there is limitation contributes in the study, such as, firstly, generalization, in which the finding of the current study cannot be generalized to all breast cancer patients in Malaysia, as current study only recruited breast cancer outpatients from National Cancer Institute, Putrajaya. This is because difference in socio-demographic and lifestyle, especially from urban and rural areas, that might influence the finding in current study. Thus, future studies are recommended to involve breast cancer outpatients from different oncology clinic and variety in ethnicity in order to generalize to all breast cancer outpatients in Malaysia. Besides, as the study design is a cross-sectional study, causal relationship of this study cannot be determined. Hence, longitudinal study design is recommended for future research so that the causal between the variables could be determined. Other limitations, including small sample size in this study, recruited 32 breast cancer outpatients in which less than the sample size requirement due to the time limitation and extensive time of the interview. Thus, this might contribute towards the non-significant finding as it will result to not be sufficiently powered. As I wrap up, it's clear that there is no significant association between socio-demographic status, anthropometric measurement, biochemical data, medical characteristic, and stress level with the consumption of fruits and vegetables among breast cancer patients. Importantly, it should be noted that the proportion of adequate intake of fruits and vegetables still relatively low among breast cancer patients in National Cancer Institute, Putrajaya. Inadequate fruits and vegetable intake among breast cancer patients is a concern that should be addressed in order to improve their nutrition and overall well-being. The finding from this research can serve as a foundation for the importance of conducting future research for better understand the factors influencing fruits and vegetable intake in this population. I believe that this insight will contribute for developing effective intervention and strategies to promote adequate consumption of fruits and vegetables among breast cancer patients, especially considering that a low number of patients were able to meet World Health Organization recommended intake level. These are the references. Thank you for your attention and engagement throughout this presentation. Let's continue to work together in the fight against breast cancer and strive for a future where every person receives the care and support they deserve. Thank you.